So let's begin the session. So I'll be talking on plan, prepare, and conquer your exams. So I'm an ex-alumni from LVPM. So most of the contents of these slides are actually taken from an interview of Dr. Pranesh Balasubramanian itself with the gold medalist Dr. Harika, Dr. Shashwanti, and Dr. Sanira. So initially in the first year, all of you will be having these doubts like, should I get all the books? Should I read the reference books also? How should I read? Should I read every day? Or should I start reading for the exams from now itself or for knowledge? Should I start reading those articles because all my seniors are reading those articles too? So I would say when the initial phase, it's always better to start from the basics, build your basics. So the best book for the standard definitions is Parsons because examiners are very fond of asking the definitions and also the clinical science also. So for that, the best thing is to read Parsons. And as we all know, Kansky is our library. It has almost everything very comprehensively. You have to read the Kansky. You have to read Kansky and revise it multiple times before exams. There is no other way to it because your eyes will see only what your mind knows. And in the initial part, I think it's better to start case-wise. This is what being done by all the gold medalists and normally everybody. So start with cases or maybe science. Like if you're seeing a keratic precipitates on the first day, start reading about it. So you can be more thorough about what is there and what are the different patterns in which KPs can be seen. So you have to start early and stay focused. Keep a scheduled time every day. Try to read every day. Maybe you can start with 30 minutes a day, slowly build up to 1 hour. At least reading for 1 hour every day, you'll not feel that guilty. And it's always better to learn from your clinics. Never miss any opportunity to see interesting cases. You have to stay focused and organized. You have to start making notes initially itself. So when you're making notes, prepare them systematically. Keep one book for retina, one for cornea, one for cataract like that. And whenever you're writing everything, you have to leave pages because you'll have to read and refer more articles and you have to add on to these notes because especially for the frequently asked questions and common exam practical cases. For that scenarios, you have to read and to add more. So this is a photograph of the book of Dr. Harini, who is a gold medalist. See, she has got a different book for retina, and in that, in the first page, she has given the table of contents, the page number, and when she has revised that, she's putting tick marks. She has got a proper strategy of how to read also. So this is a notes on CRAO, wherein she has added sticky notes when she is referring more, she has read and referred more and she is adding that also to it. And for some topics, I think this reading Kansky will not be enough. You'll have to refer to some articles also. So whenever you are reading from some articles, it's always a better idea to take a photocopy of that article and stick on to the notes, adjacent to the notes, so that finally when you're preparing for the exam, you'll forget from where you have read about it. So if you're sticking your articles also along with your notes, it will be easy for you to refer. For some topics, especially for eyelids and for lacrimal gland, dry eyes and all, this Kansky is not enough. You'll have to refer to articles, AO articles and all. So this is, I'll be giving this in the handout. So topic-wise, from where to read more. Now, in the next phase is when you go to be an exam-going PG. So when you become an exam-going PG, this is a dreaded phase where everybody will be pointing towards you, referring to you to answer all the questions. So then you have to start preparing a newer strategy. You will have to slowly increase your study hours per day. First of all, you have to get the question bank. Either try to get it from your university sites itself, or for the DNBs, it is available in the iDocs platform. And the books which you have not read, like the basic sciences, the Kurana, anatomy and all, start reading that so that you'll not panic at the last. And also start preparing for the case presentations. Now the most awaited study holidays. When the study holidays come, you have to make a proper timetable. Mind you, study holidays is only for revision. Few institutes may not be allowing study holidays also. So make a proper timetable. You have to read the topic at least once before the revision part. And for the volatile topics like the optics, for me it is optics and all, it's always better to keep the volatile topics towards the end. Once you start writing a theory paper, the main dictum is be very crisp, keep a format. Dr. Shashwanti, she was our senior, she told us that the examiner is not going to read everything, you are going to write pages and pages. So you have to be very crisp. And the clinical features, the discussion part and all, just make flowcharts. Always keep 1 or 2 flowcharts in your theory paper for each question, and just be very crisp on the what you know, because the examiner just want to know that whether you know the things. He don't want the discussion part of it. And the main thing, the mark fetching part is, whenever you are adding anything on a journal, just put the et al, highlight it so that the examiner will surely see that you read this article and you are citing from that. And also, when you are writing something about the recent advances, whenever you're reading or writing or anything regarding the recent advances, put a proper box, underline it so that the examiner will see that and will notice that you have read it. These are the mark fetching points. Otherwise, everybody will just give the basic marks. They're not going to read throughout your paper. Always use highlighters, or you can underline. It is allowed actually. And always draw big diagrams. When you're drawing diagrams, it is always better to leave spaces above and below so that the paper looks neat. And try to label only on one side. Don't scribble and label on each side. It will not look neat. Be legible. Good handwriting fetches you marks. But if you don't have a good handwriting, that is also okay. You just have to leave inner spaces in between. You have to write big. By that, your paper looks more neat. And there is a pro forma, how to write for each questions. For the clinical questions, start with the history, incidents, definition, etiopathogenesis, etc. And for investigations and instruments, again use indication, optics, etc. This will be given in the handout. And start practicing, because by the time by finish of PG is almost 3 years, we'll lose the habit of writing for 3 years. So it's always important to start practicing at least 2 months before the exams. You'll have to, most of the institutes will provide mock tests, but if your institute is not providing mock tests, sit in a group of 2 or 3 and start self-testing with old question papers. Because you have to have this habit of writing for 3 years, otherwise you will just get tired of it and you'll stop writing because of the pain, and you'll feel like just scribble something out and finish it off. So it's always better to start writing. And practice time management also. Most of the time what happens is when we see the XA questions, we stop, and if it is a question which we know very well, we'll go on writing about it, and finally you will miss out on 2 or 3 questions at the last. Mind you, especially for DNB exams, if you are not able to properly write 2 questions, you'll fail. So always make sure that you are going to write each and every question. So for proper time management, you just leave spaces. If you want to write or add more, there will be time. If you don't have any theory classes at your institute, no worries, especially for the private institute, may not be having theory classes. There are many online theory classes platform. The Arvind Eye Hospital has got classes which is available on their Oro Tube channel, wherein they also provide links for attending their grand rounds also. Even iFocus has a program. So I'll be detailing on these things. So this is the site of RP Center, wherein they have a detailed schedule of the PG refresher courses. They will give you topics. Once you join and subscribe to this channel, they will give this timetable of when there will be classes, and you can attend this. The RP Center is the only center which actually gives classes for this instruments also, because usually nobody tells us regarding instruments. These instruments, how to differentiate between them, their uses, everything will be detailed. There are classes taken by senior consultants also, and also by their senior residents. So I have attended these classes for instrument. It was really useful. Even Shankara Eye Foundation takes classes on the recent advanced topic, the IC3D classification, the glaucoma drainage devices. I have not seen these classes being taken by any other YouTube channel. The Shankara Eye Foundation has got all these classes, especially on the recent advances. This is a very good platform. So if you don't have these classes being taken at your institute, just go and click this YouTube link, subscribe to this channel. This is very good channel. Now coming to LVPA, this is their platform, LVPA Digital Education Platform. You just type this in Google and you will just go on to their site. They've got a lot of programs, especially for the postgraduates. These are the JAM articles, and you can also access their LVPA grand rounds. Grand rounds are nothing but, this is a clinical case presentation. Along with the case presentation, there will be viva, like questions being asked by the consultants, and you can actually listen to their grand rounds. This will be the rarest cases, and it is very interesting to attend these. And then they have this attention to retention program, and also you can also directly attend their webinars also if you go to this site of LVPI Digital Education. This is one of my favorite classes from LVPI, problem-based learning classes. They will take some topics. This topic, I would recommend each one of you, please go and attend this one by Ashi Morowala. This is the best topic being taken in a very systematic way. So here they will be asking questions, and they will only ask questions, and they will only clearly make you understand each and every part of it. And this is very important even for the FRCS also. For the FRCS, the Viva questions, that also will be discussed in this PBL platform. This is very good for that. They have a lot of topics being covered in this problem-based learning. This is available in the LVPA Digital Education platform. Next is this U&I program, where there will be classes being taken by the legends itself, like Tarjani madam and all, and there will be their fellows and residents who will be asking questions to madam, and she will be replying to that, and she will be asking questions to the residents. So it is like a digital Viva voicing. You can just listen to that. And these are the attention to retention programs, which is also available free in the YouTube channel of LVPI. Again, the same site, LVPI Digital Education, where they will be covering each topic, like the fugues, uveitis, everything, management algorithm, the current management algorithm for keratoconus, then the ocular myasthenia, newer treatment modality, everything is there, whichever will be asked in the practical exams. So that all things will be covered. These are short videos, just 5 minutes. So it is easy for you. You don't have to sit for long, just 5-minute videos. Whenever you are taking a break in between your study time, just listen to one video. You can get the newer points, newer things, and just add on to your note. Now comes the phase of the dreaded practicals. So the main dictum, the tick being given by every gold medalist is be calm, composed, and confident, which never happens because everyone will panic. But mind you, the confidence comes only from seeing the patients, examining the patients. So never miss clinics. Try to attend the clinic and try to learn from your seniors. Every institute will be having a different case performer. So I think before the exams, you should be by heart that very clearly. And while answering, be audible and to the point. And be very humble. If you don't know, just say don't know. Because if you beat around the bush, they'll just keep on poking you. They'll make sure that you cry. Till that, they'll keep on asking you. So if you don't know, just be humble and say, sir, I don't know that. That's enough. And keep practicing, especially how to present the cases. You have to practice. Try to practice. Like when we were preparing for exams, me and my friend, I will present a case. She'll just ask the questions which is there in the FAQ Aravind book only, nothing else. She'll just like randomly ask 1 or 2 questions, and I'll try to answer that. Then she will present the next case, and I will ask her 1 or 2 questions. So that at least by that we have that practice of how to go and present for the examiner. Because so especially for DNB exams, if you are going to a place where you don't have, like nobody will be there to help you out. So it is better you practice that also. And whenever you get a chance to present cases, try presenting cases. This iFocus program, they will actually invite hot seats. If you just subscribe to their channel, they will send you emails, and they will put the heading will be hot seats. So you have to apply for the hot seats. They will give a Google Forms platform wherein you can apply for which hot seat you want. Like if you are weak in cornea, or if you feel like you are weak in optics, just tick the hot seat for optics. So if you tick for that, they will call you and ask you, like they have a session coming on, will you be there? If you want to be there in the hot seat, then just say yes to that, and then they will call you. During that session, there will be not just you, there will be minimum 5 to 6 hot seaters, and you can be among them. And during that time, whoever is presenting will ask you questions. So you have to prepare yourself for that, but by doing that, you will get the practice of answering your Viva voice key very nicely. So books to read for practicals. There are a lot of books, but I think these 3 are inevitable. But one thing I would say about this book, everybody will be reading this Aravind FAQ. It's a wonderful book, but this is very volatile. So when you're reading for a topic, first read from Kansky, build your base, then go to FAQ, and then just mug up the question wise. Because if you're doing the other way out, if you're reading FAQ first, you will just forget everything. And this book by Recent Advances by H.V. Nema is also very good. And even this book by Prafula Kumar Maharana sir and Namrata Sharma also is very good. So these three you should must read. And when you're preparing for practicals, try to sit in groups. For some people it will be difficult, but still try to sit in groups and study. Ask for help from your seniors or the junior consultants. And when you know a topic very well, try to teach others, because when you're teaching others, we teach ourselves also. For the practical, I would say this site, this link, I'll give you this link. For this iFocus link, iFocus has got a proper strategy of OSCEs of each topic for retina, cornea, everything, where they will be discussing on the OSCE platform. This is very good, especially for DNB exams and also for FRCS. When you're preparing for FRCS also, this is very good. And iFocus, this program also has sessions on pathology and microbiology. These are sessions which will not be covered in any of our institutes, and none of the seniors also will be knowing that. They'll just give you some slides and just say some marks on the slides to mug it up. But when you're preparing for FRCS exams, or when you're going for DNB practicals, you won't get ready-made slides. You will be getting different slides. So this classes which were taken by Lalitha Prashna ma'am and Ritu ma'am was very good. I had attended these classes, and they will just clearly tell you what to look for in each slide and how to find out the case. And for refraction, by the time we reach the last term of your exams, we will forget everything about refraction. So there are these 3 classes which is available in the iFocus platform by KP sir, which is very good for a quick revision and for the practical part. And if your institute or the center at which you are, if you don't have OBSCAN available, BSCAN, ASOCT pictures which are not available if you're a center, there is this study group which is known as a Spotify study group. And in that you get all the scans, there will be spotters, the OBSCAN will be there. Beneath that they will give the diagnosis also. Everything is there. Like the OCT macula, the recent pictures, the clear pictures, everything is there. So just go and join this site. From that you can get all these scans. So you'll be very confident whichever scan they give you, you can prepare and you can answer. So this is my courtesy. Mainly I've taken from Dr. Pranesh only, and remaining things from Dr. Pradeep Gupta and Saurav Deshmukh. Thank you. So before leaving, just give me your email IDs and phone number. I'll be sending all these links, the iDocs question banks, DOS articles. I have got a collection of the main important DOS articles. All these things, I have formed a folder for it, and I'll be sharing that folder. I'll give access to that folder to all those who have attended this. From that, you can get the whole thing. Thank you.
Thank you, Rakhi, for that elaborate